It's gone 10:30, so we'll make a start. Before I make a start, can I just welcome two new members to the Social Work Services Committee, Douglas Fairbairn and Archie Dryborough. Can we have the Sederunt and apologies?
Thank you, Chairman. We've currently 13 members present. Apologies from Councillor Dempster. I believe that Councillors Brodie and Councillor Nicholl will be joining us, as will Councillor Maitland.
Members, are there any declarations of interest? No, thank you. Move to item 3, which is the minute of the meeting of the 29th of September. Councillor Scobie.
Yeah, Chair, I'm not quite sure that we've got the correct minute or the accurate minute as such. On page 2 of 134, reference item 3, minute of meeting of 23rd of June 2016, and it's the first part of that minute that I would dispute. Agreed that members were not in a position. I don't think that is the correct wording. I think that what members have said, and I was not the mover and seconder to that motion, that it was not appropriate for the committee to take that decision, but deferred the matter to the next full council.
We did agree that amendment and we noted the minute. Yes?
Quite happy to raise it at full council, Chair. It'll come back at full council.
Fine. We can agree the minute. Thank you. Move to item 4, which is Children, Young People and Lifelong Learning Services Revenue Budget Monitoring Report. The report will be presented by Angela Patterson. She'll be assisted by Colin Pentland. Angela, anything you want to add to the report?
Thank you, Chair. Good morning, members. As you're aware, Children and Young and Family Social Work Services is now part of the wider Directorate, Children, Young People and Lifelong Learning. And this report presents the financial position for that directorate as a whole and will be presented to the SIPL committee on the 12th of December as well. The position for SIPL as a whole is an overall balanced budget by year end. With regard to the social work services elements of the budget, the projected position is currently, based on figures at the 30th of September, an overspend position of 129,000. And we continue to monitor that budget closely, and there are actions in place to increase compensating efficiencies in other parts of the budget. And we are hopeful that by year end we'll be able to present a more favourable position, but currently the projected position is the 129 over. So we're happy to take questions on that basis. Thank you.
Open it up to members. Councillor Dick.
Thank you, Chair. I understand from 2.1 that we're looking at the social work services part of the Children, Young People and Lifelong Learning, and this is the Revenue Budget Monitoring Report for this. My understanding was that Social Services Committee would also scrutinise the IJB budget, or the Dumfries and Galloway's delivery of the part of that IJB budget. Can you just confirm that will be the case and when that budget will be before us, because obviously that will be separate from this?
Yes, thank you. The IJB position is presented to the Integrated Joint Board, and members of that board are provided with that revenue report, and then that then becomes a public document available to all council members.
Thank you, Chair. To follow up, what I'm really getting at is, will we have a separate report before us within the committee papers, not just be able to scrutinise it on, as a public document? I was expecting, in fact, I was certainly allowed to expect that we would be getting reports on that part of the budget in Social Work Services Committee.
Councillor Dick, if I could advise that that report goes to full council, not Social Work Service Committee.
Councillor Scobie.
Yeah, Chair, on the same heading, lifelong learning and well-being, and I just wonder if Angela's able to comment on this part, and it's really to the learning part, I think the support for learners, and indeed what I understand as children who fall within 1, 2 and 3 matrix may not be getting the support that they require throughout Dumfries and Galloway, because it's been concentrated on, and rightly so, the one-to-one under matrix 4. And whether indeed this is a true reflection of what's happening out there in the field with children who are not being supported to the level that they should under matrix 1, 2 and 3, and that we could be in breach or legal responsibility under the coordinated support plan.
I'm not quite sure what your question is, Willie. Could you just be a little bit more explicit?
My question is whether we are providing the services that are required out there in the support for learning under what is regarded as a matrix, where it's on levels 1, 2, 3 and 4, where we may not be providing the services that are required in levels 1, 2 and 3, where most of the funding is being directed to level 4. Which could be in breach of the coordinated support plan. Are we delivering what we should?
If I'm correct in understanding your question, Councillor Scobie, it's with regards to the education provision?
It's deliver education, but it's a coordinated support plan where all agencies are involved. That's social work, education, wherever else the agency working, wherever else that support may be coming from. And it's the levels in 1, 2 and 3 that the education are finding difficult to deliver, because it's concentrating on level 4 on one-to-one.
In terms of education, I'll request that our colleagues from Education Services respond to you with that request.
Councillor Hislop.
Chair, it was just with regard to the 130,000 underspend within the resources team. Is that allocated to the social work budget or to the education side or lifelong learning side of the budget? Because the rest's broken down, but it doesn't say where that 130,000 is allocated to.
Chair, thank you, Councillor Hislop. That underspend position is factored into the overall position for the Directorate as a whole. So under the previous structure, resources, there was social work resources as part of social work. Now that we have the new Directorate, Children, Young People and Lifelong Learning, my division of that is resources for all of SIPL, and the current underspend is factored into that overall reported position of a balanced budget, rather than being attributed to the social work side only.
Councillor Wood.
Thank you, Chair. It's with regard to 3.5 and 3.11, kind of continuing along in the same theme, where there's been underspends, but it's also the staffing vacancies. Are we using staffing vacancies as a budgetary measure, or is it because we cannot fill the positions? And if we cannot fill the positions, what are we doing to ensure that we do fill these positions?
Councillor Wood, we do have some issues in terms of recruitment and retention, particularly for the west of the region. We have taken some measures in terms of trying to advertise in different areas to try and encourage recruitment and retention, but there is a recruitment issue across all of Scotland in terms of social workers.
Are we monitoring the impact of these vacancies? Because I know of a situation within my ward where it is having an impact on the educational side.
We certainly are from social work, and again I can speak to colleagues in education to ask you to ask for an update for you on that matter.
Councillor Maitland.
Thank you, Chairman. Could you possibly just tell me, please, the underspend in public protection, which is very minor, but I wonder what it's about. If you could just explain what the underspend is.
Yes, Councillor Maitland, that is in respect of a delay in the appointment of a key officer within that team who is now in post, and that is fully functional.
Sorry, no other member? Okay, can we move to the recommendations as contained in 2.1, 2.2 and 2.3 where we're asked to note? Thank you. We'll now move to item 5, which is the Chief Social Work Officer's annual report for 2015-16. We're being asked to consider the performance of the social work service in respect of key duties and responsibilities for which the Chief Social Work Officer has overall responsibility. The report will be presented by Lillian Kringle as the Chief Social Work Officer.
Thank you, Chair. Members, my report provides an overview of social work services, activity and achievements during the period the 1st of April 2015 to the 31st of March 2016. This is not exhaustive, and rather it seeks to summarise activity per care group. As members are aware, this has been a particularly challenging time for the service as we deal with reductions in resources in the ever-changing national picture. I believe, however, that we have managed to provide members with an overview of the positive outcome for some services. However, I do acknowledge that we still have a long way to go in the continued development of social work services within Dumfries and Galloway. I would wish to take this opportunity to thank the convener and the vice convener for their support to the service during this period, and extend my thanks to those elected members on the Social Work Committee who have been particularly supportive in our continued journey. And I would submit this report for consideration.
We'll now open it up to questions and comments from members. Councillor McKee.
Aye, thanks, Chair. I'd thank Lillian for this report. I think it's a very good report. I think we've got to recognise the difficulties that social work faces daily. What I'd like to highlight actually is the report, individual reports on individuals. I think they really bring home to us what the amount of work you've got to do with some individuals and what you achieve at the end of the day. And I think it's very encouraging that these youngsters are prepared and allowed to develop, and they are developing. And I think it says a great lot for the staff that's working with these people. And it covers a wide sector, just as you say, it covers for the wee wains, if you like, right through to the elderly, sometimes older than me, but there you go. And I think it's good that you're highlighting that, because these are things that very often go unnoticed. You go to schools and you hear of the high achievers, and there's a story in here about a high achiever as well, and that's really welcome. But there's more to life than just high achieving. There's developing yourself as an individual, and the help that you're giving to these people is immense, and I think you should all be congratulated for that, and thanks very much for your report.
Okay, thank you for that comment. Councillor Dick.
Thanks, Chair. I would just like to echo Councillor McKee's sentiments from my group's point of view. Appreciate this report and also the work that social services do, considering the pressures that they are under, both through the type of work they do and also the financial constraints that exist. I'm particularly gratified to see the one report about the youngster who was brought back into region, because I know that wasn't just a budgetary consideration. I think it was you yourself, Lillian, had explained this, that the outcomes for children living closer to home are so much better, and appreciated that. I have one specific question on page 39. It's regarding the mention of the social care fund of the 7.6 million, which is allocated in Dumfries and Galloway. I'm still a little unclear just exactly what's happened with this. Could the committee get a briefing paper out in the short term with a breakdown of exactly what it's been spent on, if it's been spent, what it's allocated to, and so on, and then with a report to come back to the next Social Work Services Committee? I'd be grateful for that. Thanks.
Yeah, happy to do that, Councillor Dick.
Councillor Driver.
So thanks very much, and I echo the previous speakers on the good report here, and specifically on page 75 of 134 or 23 or 63, depending on which way you actually read it. The examples of good practice with community link workers, and I'm looking at opportunities and potential future good work that may be done in that particular area. And I sort of say this.
Councillor Driver, we're still on item 5. Oh. That's item 6 that you're referring to there.
Sorry, Chair.
Yeah. However, I will make sure that you get to speak first. Councillor Maitland.
Thank you very much. I'm still on report number 5. Chairman, yes, this is a very clear report, and I think it's very helpful to have where we are at the beginning of the year laid out, so where we are at the end of the year. I think that's extremely helpful. I'm slightly less sort of upbeat than other members. I think our Chief Social Work Officer has laid out challenges, and in particular, one of the things which we seem to be struggling with at the moment is the culture of users of direct payments. That seems to be very slow, and it's echoed, actually, it comes through in the next report, which I'm sure that Archie will talk to us about. But we do seem to have a problem in persuading people and families of users to take this up. And I wonder if we could maybe pick away at that, whether that's something, or whether you see reasons for optimism from the beginning of this year to the end of the year, the end of the period covered by this, or whether we should be thinking as a committee about how to actually activate this more.
Thank you, Councillor Maitland. Absolutely acknowledge that it's been a challenge for us, particularly in children and families, but we have doubled our efforts in terms of engagement with families to try and waylay their fears of moving towards self-directed services rather than services being presented to some families. So I would be hopeful that when I do my report this time next year that you'll see a far clearer pathway in terms of an increased use of self-directed services.
Councillor Fairbairn.
Very positive report, yeah, absolutely. Just one concern I have, really, might be a daft laddie question, but looked after children out with the region. We seem to have a lot of people within the region that are looked after, not by the local authority. And there's a lot of concerns being raised by local residents to myself in relation to this, because obviously there's disruption, Police Scotland are involved. That's right. What's our take as a local authority on these looked after children out with the region?
Thank you, Councillor Fairbairn. Yeah, we have an ongoing issue. We have a significant amount of residential provision within Dumfries and Galloway that is registered to the Care Inspectorate, and the Care Inspectorate have the overall responsibility for the management of the units. Myself, along with colleagues from Police Scotland, continue to engage with the Care Inspectorate to deal with some of these ongoing issues. Unfortunately, it's not in our gift to influence the young people who are placed within the units. It has a significant issue for us over a number of different areas and aspects of service delivery, but we do continue to challenge and work with care providers in the region to address these issues. Unfortunately, some of it is out with our control and it's out with the local authorities' control, but we have put formal submission to the Care Inspectorate with regards to these matters.
Councillor Scobie.
Yeah, Chair, I refer to page 26 of the Chief Social Worker's report, and it's the paragraph beginning, within children's services we made a considerable progress on our programme to return children and young people previously placed out of region. And it goes on to talk about that what we want, that the drive is to deliver delivering of our autism strategy to create fit for purpose, fully supportive local provision for our families coping with autism. I refer not only to autism, but children with profound disability or just disability. And I asked the Chief Social Worker if we have made the significant progress or considerable progress that's been referred to here in terms of the resources west of the region. I'm talking respite and so forth. Where we have just had a setback, where one of the agencies has withdrawn their services, even though that service may not have provided for under 11 in the way that the families were expecting.
Councillor Scobie, I can give you assurance that we are making progress to address some of these issues. I would highlight to you that this report is up to 31st of March 2016, so that withdrawal of that unit at that point would not have been reflected, and also that was not a commissioned service from the local authority. So whilst that has presented challenge, it still remains available until the 31st of March 2017. We do acknowledge that within the west of the region we still have some issues with the third sector care providers engaging with us, but we are undertaking some significant work to look at the respite provision, and there is ongoing review.
Could I come back on that, Chair? And I accept that this is a report up to the 31st of March. And if we could have, and no doubt it will be reported in the half-yearly report, but it's accepting that the particular service was not a commissioned service. Then equally, if we're making considerable progress, I would like to see that being featured west in terms of the resources that are available west of the region, and for that to be a particular, because it is, we do need to make significant improvements west of the region in terms of the delivery of services, because it's equally as difficult if the services are 75 miles away from the people if they require respite.
I can give you confirmation that we're continuing to work to address those issues.
Councillor Wood.
Thank you, Chair. Within criminal justice, and looking on page 19, where it's the multi-agency public protection, there's talk of a tendency to be over bureaucratic within the system. Can you expand on that? What was the bureaucracy, and how is it going to be taken out? Because I see we're moving into the new community justice partnership, and what benefits it's going to be to that new organisation, and will there be any financial savings?
If I could address the last question, sorry, first, Councillor Wood. The Section 27 budget is ring-fenced. It is allocated on workload. So when it comes back to Dumfries and Galloway, I believe that we'll have a fairer settlement directly from the Scottish Government than we did receive under the South West of Scotland Community Justice Authority. The bureaucracy element that I discuss within criminal justice is linked to us being part of the Community Justice Authority for South West of Scotland, and I believe that we will have a much more effective intervention service delivery when we bring criminal justice back into the control of the community planning partnership under Dumfries and Galloway. So much of the bureaucracy that I discuss in here will be lessened because we will be delivering our own service within Dumfries and Galloway.
Councillor Syme.
Thanks, Chair. Like my colleagues, I'd like to commend Lillian on this report. Just on what the members said earlier, we're also keeping an eye on the outside agencies who have children in this area through the police, and it's on the agenda for the continuous improvement group because it has been a big issue. I'd just like to say that on page 39 at the top, that I think that a lot of members were glad to see there that we're still mentioning our 6 activity and resource centres in these reports. If members remember 2 or 3 years ago, these were under threat. And when you see the difference that these make to families, I think it's really important that we're still supporting them and the vast support that they give to families. When we were looking at these and they were under threat, we weren't just getting a lot of activity from users and families, but we're getting it for the wider community because they recognise how valuable they are. So I'm glad to see that we're still supporting these centres. Thanks, Chair.
Thank you for that comment. Councillor Dick.
Thanks, Chair. Just when Councillor Syme brought this up there, I visited our own local ARC recently there, and what struck me in all the times over the years that I've visited it is what an excellent facility is. It seems to be completely underutilised, and there must be some way we can make an increased use of that, whether it's multi-agency or whatever, having other groups in there. I think there could be much could be done on that. The other one I wanted to bring up was, and Willie's already mentioned it, the Kinvara situation. I'm not going to rehearse anything that I haven't already spoken to officers about, and could I just say that I'm grateful for the responses and answers I got from your staff, Lillian. But there were 2 issues which I have brought up that I have major concerns over. Not so much being a non-commissioned service, this particular building, it was still used by Dumfries and Galloway. Now the issue has come up, and it's come up before. When we commission outside groups to provide services for us, the concern I have is that they can arbitrarily withdraw without consultation with the social services. Because basically, if there's advance warning, at least other provision can be made for it. And in this case, there were users using this particular facility. The other thing that struck me and asked for confirmation of is that if an outside organisation, such as the one that ran Kinvara, are allowed to develop services or develop a business case which ultimately goes wrong, my concern is that the impact on that business and its viability, sustainability, could be substantially impaired to the point where we may be in a situation of losing one. Now, I doubt that's the case in this case, but it does raise that point. It means, I think, essentially we need to have some kind of control over, or some way of examining the business model, the organisations from which we commission services, is scrutinised by the social work.
Councillor Dick, accept the comments you've made. I would give you reassurance that in terms of our commissioning strategy, we continue to address some of the issues that you have raised through that. In this particular case, that service was set up without consultation, and as per any organisation, they have a right to introduce a service to any region, and we have no control over that other than if we are if I become aware under my statutory duty of any concerns. But we continue to work with our partners to have a very clear strategy for making sure that any service that is developed within our region is something that we would wish to be working alongside colleagues with.
Councillor Nicholl.
Thanks, Chair. Just congratulations to Lillian for bringing this report forward, warts and all, and it comes forward with considering the serious financial constraints you're under and personnel constraints where you're short of social workers, you tell me. It's good to see it, but we're 9 months into the next year. Is there any chance that this could come forward? I know there's a lot of information in here, it takes a lot of getting together, collating, but is there any chance that we could get this report a bit earlier in the year, or is it traditionally at this time of the year?
If I could just advise Councillor Nicholl that it's a statutory duty. It has to be submitted to the government in September, and it's embargoed until December, so I'm unable under legislation to report earlier. It goes to the Chief Social Work Advisor to the government for agreement before it can be published.
Councillor Thompson.
Thank you, Chair. Couple of points. One was just on the user and carer development of user and carer strategy. Obviously, that's something that in the next report we might see that there's a few challenges in terms of how well engaged or signposted users and carers are in terms of services or support available to them. Hopefully, next year's report will, when we get it in December, say a lot more about how that's improved, because that is an area I think that we need to build up, given the number of carers in our region, often unrecognised. And also, one of the things that isn't touched on in here, but is critical to delivery of service, is staff absenteeism, which we know sits at around 6 or 7%-ish. And I'm not sure if that's breakable down into whether that's adult services or children's services, but I'd be interested to know if there's any further information on whether it's under the children's services or adult services that we have a particular difficulty. Also, there's geographical factors as well, I understand, but it's not in this report. So it's just really, should it be, and if not, then will we get more information on that?
If I could just respond to that, Councillor Thompson, the content of the report is again dictated to by the Scottish Government and under the legislation, and that is not an element that we are required or encouraged to report upon, but obviously under the performance for social work at this committee, I will continue to report and we'll break that down in future. Yeah, but it wouldn't be contained within this report.
And on the carers, support for carers and users?
Yeah, we certainly continue to support the Carer Centre to ensure that we have the correct resources within budget to continue to address some of the issues, and I would be confident that you'll see that clearly reported in next year's report.
Councillor Tuckfield.
Thank you, Chair. Taking the point that Councillor Dick made about the ARCs emptying or being empty most of the time, I might see that as a positive step, because at long last we are providing or participating in providing meaningful occupations for them to carry out. And I particularly would point to the Potters project in Stranraer, which has grown from a couple of old derelict buildings into a really superb project run by a group. And I think for me, that is the way that we should be going. An ARC used to be available when there was absolutely nothing for people to do. But there may be other people moving in to the ARC that actually need an ARC. But my hope is that we will continue to provide meaningful occupations for people who are able to take them up. Thank you. And I would also commend this report. It's superb.
No other member. Can we move to the recommendation? Consider the performance of the social work services. Yes, and I can add my own commendations for the excellent work carried out by the Chief Social Work Officer and her staff. Thank you. Now move to item 6, which is the joint inspection of health and social care for older adults. I think there has been some comments in the media that this isn't a particularly good report. I'd like to sort of correct that assumption. It is in fact quite a good report. It is something that it's the very early days in the formation of the Integrated Joint Board, and I think if you read the report you'll see that we are in fact above Scottish average. The report will be presented by Heather Collington. Heather, do you have anything you wish to add to the report?
Thank you, Chair. I think one of the key things is that though this is a joint report, we wanted to bring it to Social Work Committee so that we could highlight some of the specific social work issues within the report. And under 3.5 you'll find a reference specifically to the findings around outcomes and person-centred approaches, as well as sort of our adult support and protection and commissioning. And we just wanted to highlight those because those have been key themes for us as a service that we've tried to bring you and for you to think about. I think, as Chair has said, it's very early days, So we are very pleased with the outcome of this. We have an action plan in its final stages of being developed, and I can reassure that everything on that action plan that's come from the recommendations is work that is already underway or just about to be started. So it's all stuff that we've been aware of, again, at this early stage of coming together as an integrated system. So we're quite confident around being able to sort of improve on those grades next time round. But we feel this is starting us from a really solid base, given the time, in terms of the timing of this. So I'm happy to take any questions.
I'll open it up to members. Councillor Dryburgh.
Thanks, Chair. Now that I'm on the right report, I welcome this report. As you say, it may look a bad report, but when you look at it compared to the rest of Scotland, then it is a fairly decent report. Looking at the page 75 of 134, or 23 or 63, depending on which one you want to look at, and when there's examples of good practice, I think that should be taken right across the region. For instance, in Annandale and Estill, we have community link workers in the 4 different areas of Annandale and Estill, and I think they're doing a really good job making sure that those vulnerable people, isolated people, are getting the services that are required of them. However, they did raise an issue with me when I spoke to the link workers, and I fully support what they're actually trying to do. With regard to our taxi card scheme, at the moment, where vulnerable people are people who are isolated and can't get to places without public transport and all that, they have to go to their general practitioner for a taxi card scheme form to be filled in. General practitioners are now saying that they are far too busy to actually fill the form in. And I wonder if this is an opportunity to ask Lillian to take back to the IGB an opportunity for community link workers to actually fill in the taxi card scheme form for those isolated, vulnerable people and use it that way.
Councillor Dryburgh, absolutely. We will take that forward and have that discussion.
Councillor Dick.
Thank you, Chair. I mean, it's certainly a report which should give us lots of concerns. I appreciate that it's early days, and quite frankly, this was just reading this is why the integration service was set up, to deal exactly with this. There are a lot of concerns reading through all the various 9 points. I appreciate there are certainly some good news stories in there, the performance of stars, for example. The one that it really highlights for me, or the set that it highlights for me, is the difficulties experienced by carers in accessing respite, the difficulties in developing initiatives such as Step Up, Step Down. I think that's been highlighted over recent months, and I think that's possibly one of the more fundamental things that I would hope that the integrated service would address very quickly, because it seems to me that's a fundamental tenet of any of the difficulties that have been highlighted within the report. Can I just ask one thing there? I understood that this was supposed to start after the children's report, and yet it was waited a year before it actually began. I had this, as I understood, was agreed that as soon as the children's report came out and had been dealt with, that the older people's healthcare improvement would begin. Could I just confirm that was the case, and if so, why did we wait so long?
The Care Inspectorate changed the programme of inspection, and Dumfries and Galloway were scheduled in to have the report progressed in January 2016. So it was as a consequence of a change of timetable from the Care Inspectorate.
Councillor Davidson.
Thanks, Chairman. My own microphone doesn't seem to be working. This is it's only my second meeting ever, so you can feel free to welcome me at the appropriate time, or not, as is your pleasure. That was the last meeting. So you maybe entertain a slightly daft laddie question at 3.7. I mean, I think Councillor Dick makes a reasonable point that what we've got here is the starting point, and it does really demonstrate, I suspect, why integration is a necessary thing. I'm looking at 3.7 where it refers to the action plan, and what I'd like to know, and apologies if it is therefore a daft laddie question, is when this committee would have sight of the action plan, I suppose, with regard to the bits that we remain responsible for or would have a scrutiny or oversight of.
Yeah. The action plan's just been finalised and we need to discuss it with the Care Inspectorate, and we need to get sign-off from the Care Inspectorate, and it'll need to then go to the Senior Health and Social Care Management Group as well. And I would hope then that after that it could most certainly come back here. And by that stage, hopefully it would not just come back as the action plan, but we could bring it back as an initial progress report for you, so that you can actually see the work that we've been doing in the process, because we're not waiting for the action plan to be signed off in order to do the work. We've already started some of that clearly, so we can bring you that back so that you can see both of those, and then hopefully we'd get regular reports back as well for you.
I think that sounds like a thoroughly good idea. I think action plan and combined progress report would be certainly very helpful to a new boy to social work as I am.
Councillor Scobie.
Chair, could I refer to 3.61 on page 48? That identifies the partnership should develop and implement a joint coherent approach to improvement, and then it goes on to touch on the 3 bullet points, which again we can see on page 59 of 134. And while I recognise that the partnership is in an early stage, and that indeed we may have 2 reporting mechanisms, one to social work and one to perhaps the IJB, but then we have a further one in terms of area committees who have responsibility for the monitoring of services. When I look at the one on the recommendations for improvement on page 59, I relate one to item 4 on that page, where yes, we should support early intervention and prevention. And one of the areas that Councillor Tuckfield referred to in Stranraer at least, and I would hope that could be the blueprint throughout the whole of Dumfries and Galloway to the Potters project, where people suffering from depression or whatever, then there is an outlet there with positive training and for social work to seriously look at that particular project and perhaps look at how we can core fund that one. But in terms of the supports hospital discharge, and then looking at item 4, that those that are discharged from hospital and they have certain needs, aids and adaptations, etc., but that I would look for improvements in terms of kept informed of reasons for any delay. My experience on working on some of the casework has been that people have waited an exceptional time for some of their assessed needs and the requirements that follow from that, and also that they are really not given any time scale, or on a large number of cases they are not given any time scale as to when these would be addressed, or indeed informed of who to contact if their needs increase in the meantime. I think we should be looking for improvements on these 2 areas, and I have asked the IGB chief manager for cases where people have been discharged, they have assessed needs, but they're being discharged to their homes without the proper facilities being in place, and indeed some of these. Some of the patients who have been discharged could end up being prisoners in their own homes from some of the resources that are not available on their discharge. Could I ask Heather to look at these 2 areas in terms of communication in the delivery of the requirements on discharge going along with the care plan?
This is a really key area in terms of the action plan, and there's a lot of work going on already around what's being called flow, in terms of flow coordinators being appointed in each of the localities, and their purpose is to assist the flow of people, hopefully before they even get to hospital, but then through the hospital system and out, And so what we're trying to do is streamline that, but we're also trying to be sure that actually we're not setting expectations for people of what they should get. We're trying to be much more person-centred around actually as soon as somebody comes into hospital, being able to have the conversation about what it is they will need to have in order to be discharged and trying to put that in place. So there are a couple of sort of pieces of work that are being tested out. Certainly in Nithsdale there's a piece of work around DG1, DG2, where again we're trying to look at things like bringing together a whole team approach, where again we'd look at how can we sort of increase in terms of the timescales of getting people out, so get them out much quicker, but in a way then that allows them to go out in a short period to have a core set of support whilst we do some of the further assessments. I think we're really clear that it's not always possible to do a proper assessment of someone whilst they're still in hospital. You need to see them in their own setting at home. So we're trying to look at ways in which that could be improved, and that should then have a knock-on on the issues that you're raising, Councillor Scobie, around sort of making sure that people have got what they need when they need it, when they come out. But this is a huge change in terms of a change of the model that we're using, and therefore, we won't get it right all of the time. It will have to be sort of developing as we go, learning from some of the things that we do, and then continuously putting in changes to sort of take that forward. But there's a lot of really quite exciting work going on, and I would hope that when we bring back the action plan and a progress report, we can demonstrate some of that to you.
Can I go back to pleased to hear what Heather just responded there. But rather than be anecdotal, can we perhaps be more realistic in terms of if an individual, and I've experienced this, where an individual is in for a hip replacement, for instance, and is ready for discharge from hospital, but on discharge, that person may not be able to get in and out of the bath. And it is then left to the individual to find their own means of how they keep their personal hygiene in that respect. And what the person may need is a walk-in shower or whatever, but yet this period of we're waiting to see just how they cope at home sometimes is not realistic in terms of the individual keeping their own health and well-being for their own personal hygiene. So I would hope that there is a realistic look at this, and not just, it follows that the period on which the assessment is being carried out leaves the person with their dignity and respect being withdrawn.
Councillor Scobie, I'll just respond to say that clearly can't discuss individual cases, but we would look at every individual in terms of ensuring that those resources were in place.
Chair, I can assure you I was not referring to an individual case. I'm talking in general, and it's around the respect and dignity along with what Heather was saying. And I want to ask about how realistic in terms of further assessment while at home, when that individual may not be able to cope in getting in and out of a bath.
There's ongoing assessment available, and we'll continue to work on that.
Councillor Wood.
Thank you, Chair. On page 58, it's with regard to where they're talking health and social care integration, and it's really a very positive statement that's coming out of there, although it does make mention of the need to accelerate in the development. What are we putting in place to ensure that acceleration does take place and we do, get to where we want to be?
I think that's key to and absolutely core to the action plan. I think there's a real acknowledgement about pace of change, and that what we're looking at for in the actions and how we're trying to set them out in terms of giving quite senior leads to each of the areas. That means that we're actually looking at a coordinated approach, that we can keep our eye not just on the progress of each of the individual things we're doing, but equally on the progress of what does that mean in terms of overall pace. Because it is about how we sort of scale things up to then have a real impact from sort of initial maybe sort of things that we might test out. So I think there's a real awareness that's a key issue for us about it's not just about having the right ideas and the plan in place, it's about how we actually implement those and therefore how we actually make sure that that pace issue, which the care inspectors have rightly spoken about, that we actually keep our eye on that because that is the key that will make the difference if we're able to sustain that sort of pace.
Just just to ask, do you believe that we have the capacity then to deliver on that?
I think we've looked really clearly at the capacity across the system, and I think we're looking at how we pull in that. And I think one of the key things is about this has to be something that we do with people, and that's about with people who use our services, carers, but also with our staff. So it's about taking an approach which is making sure that people are involved and participate in that change, and in that sense, looking at our capacity from that perspective. And in that sense, yes, we should have. Again, it's about how we do it differently. And there are some real changes that we want to put in place.
Councillor Nicholl.
Thank you, Chair. Although it's a better score than the average for Scotland, let's not get carried away, it's not brilliant, but it's got 7 adequates and 2 goods, so I would consider it to be an adequate report. An adequate says strengths just outweigh the weaknesses. Now, presumably they will come back and do another inspection. Firstly, I'm wondering what is the timescales. I mean, this was done between January and March of this year, which is nearly a year away. When did you get the report back, and timescales of bringing it forward, and when do you expect them to come back and see if we're getting more goods than less adequate?
Thank you, Councillor Nicholl. To answer your question, whilst we accept that this would be viewed, in our view, as an adequate report, it was slightly better than our own self-assessment, so we were absolutely aware of where we were at as a partnership. The Care Inspectorate cycle of inspection is a 5-year cycle, and consequently we have not been, as with the Children's Services, we were put into a measure that meant that they would come back and do progress reports. They won't do that with Adult Services, so the timescale potentially will be a 5-year cycle. However, as Heather has quite rightly articulated, we will do the action plan and we will continue to provide members with a progress report. But in terms of a full inspection, it is likely to be not for another 4 years. We received the final report in October, and we now have to submit back the action plan to the Care Inspectorate.
Councillor McKee.
Thanks, Chair. I was just on page 75, he mentioned building healthy communities, and the work I've seen them doing and that they do is a great piece of work. It gets people out of their homes, gives them exercise and their social aspect as well, which is greatly appreciated by them. What I was wondering was the local community councils are setting up community resilience teams or groups and looking at where people are that may, in emergencies, require support. Would you make use of that, or can you make use of that, and can you supply information to them? Or I know the difficulties with information, that sort of thing, but if the community could be involved in some way, it would also help. And just as an aside, I mean, a few years ago, I was up in Kirkconnell at a meeting, and when I came out, there was a social worker and a health worker talking, and one was saying to the other, right, I'm going up to so-and-so's tomorrow, are there anything you want me to do to save the other one travelling all that distance out? And I think that may be happening quite a bit across the region, and needs to, obviously, it's got to be encouraged. And probably the big problem is above that level. It's not on the street level where they're providing the service, but it's the management structure above that might not like that sort of thing. Just as an aside, like, you didn't need to respond to
that. Thank you for those comments, Councillor McKee. I would say in terms of the Youth Community Councils under resilience, then yeah, we do link in with those colleagues when we move into the emergency planning, and under the Care for People responsibility, which sits with myself, then we do link in terms of resilience and using that assistance on the ground when we're faced with challenging situations. I would also respond to your question where we do have much more positive working relationships at all levels of both organisations, but we recognise the partnership still in early stages, and we continue to grow those, developing joint challenges that we both are facing.
Councillor Dick.
Thanks, Chair, for letting me back in. I think you maybe answered one of my questions about the fact that you did an assessment which was poorer than the care inspector's one, which means, because I was going to ask, I assume that when they changed their date, that you started work after the child's report on what would be expected more or less immediately, given the fact that you had an assessment in place. Can I ask, when we come to the recommendations, that in view of the point that Councillor Davidson made that at the next meeting, could we get an action plan timescale in place so we can see what you're doing and when it's going to be done, and maybe an interim progress report at that point? If we could add that to the recommendation, Chair, I'd be grateful.
Councillor Maitland, and I apologise if I didn't see you raise your hand before. There's a good deal of shadow around you just now, like.
I know it's difficult when the wind is behind. Chairman, I think other members have said that when you first read this, and I went on to the Care Commission's website to check out what other people were getting, and yeah, I didn't think actually this was particularly good, and I'm quite surprised to hear that we're above the Scottish average, because I was a little disappointed, because in fact reading it would indicate that we're doing the right things and facing the right way, and there are examples of very good progress. But I wonder whether it's the classic Dumfries and Galloway problem of us all being rather nice to each other and maybe not challenging each other to go faster, quicker, more determined, more energy in terms of improvement. I absolutely echo my colleague's suggestion that we should have the report back again, and the action plan. But I want to think about the process here as well, so that members understand what we should and shouldn't receive, and what we can actually really definitely influence, and how, because we have delegated 55 million quid of the social work budgets to the IJB, and I would like to know how in the future that we are going to influence this process, with particular reference to housing, which is in here and doesn't actually come up terribly well, in terms of people thinking that they got an opportunity to plan and to make to influence the situation. So where is all this going to come through, and how?
Councillor Maitland, thank you for those comments. If I could answer them, in terms of the national average, some of our difficulties remain that NHS Dumfries and Galloway have put all services into the IJB and put them into health and social care integration. So if you actually have a look at the national average, given our current situation, we are slightly above the national average, and that may explain why we are. In terms of the governance and the reporting, then this report sits within the remit of the IJB. However, as Heather's quite rightly said, the leads for the improvement sits with myself as well as the Chief Operating Officer. So I can assure members that we will be at the table and influencing where we can the changes in the service. However, in terms of the setup of Dumfries and Galloway, without a doubt, the health input is much larger than the local authority input, but nonetheless we will be part of the action planning and the progress.
Thank you, Chairman, for letting me back. That's helpful, and but at the same stage, I think members, have got to be clear. We have this put down in front of us, and we've got to then be clear about what we actually can influence and push forward. And because I'm well aware that there is performance management, and they actually rather like that in terms of the localities. They think that's really good. But I think there's an argument to say that the action plan must make the role there absolutely explicit, and the feeding back from the localities as to where it goes, what happens, how they know that action has been taken. And in order to head off any problems in the future, we've got to get these things absolutely clear. Otherwise, there will be problems. We've seen it before now. So I just put that down. Maybe that could become part of the action plan.
Certainly to continue to provide members with the progress report.
Councillor Thompson.
Thank you, Chair. I wanted to look at, well, page 9 of 63 or 61 of 134, and it talks about the STARS programme, which I've always felt was a very positive and sort of, it's a new model of, encouraging independency in that sort of initial period when somebody gets back to home. Yeah, but the problem is there that even STARS, which is a kind of success story or a model of how things can be done in a new way, is effectively put into a culture where it's almost doomed to fail because the rest of the services around it aren't getting the, they're effectively having to do mainstream care at home because the other services aren't able to provide the care at home because either we have a recruitment shortage or we have a difficulty in recruiting in a rural area, or we have absence of staff, or we have any number of other issues you could choose to pick throughout the report. I have a concern that although we want to see an action plan that's going to actually address the issues that we've seen here, some of the actions that we've already carried out that do work or could work aren't being given a good chance to succeed. So I can't imagine if that affects the morale of the staff whenever they think, well, this is actually a good idea, but actually the environment we're doing it in isn't allowing us to flourish as well as we could. So I'm looking forward to the action plan because clearly, I mean, there's nothing really that new in this report as far as I can tell. I don't know when we first realised that there was a shortage of step-up, step-down care in Nithsdale. I mean, that's not news to me. I don't know if about other members around this chamber, but I'm sure there's been a number of actions and plans and inspections carried out over the time, but there's some fundamental things here that we've not addressed in this region for a long time, and I'm just hoping that this is a great opportunity to do that in an integrated model. So, but if you've got any feedback on the STARS and how that's looking now, because that was always seen as a kind of positive story, and I remember supporting it at the time.
Yes, in terms of STARS, I think there have been concerns about have we stuck to the original remit, as it were, and how far have we diverted from that. And I think some of the current thinking is about how do we maximise what STARS is about, and how do we make sure that it's used in terms of reablement. And it is about supporting people out of hospital for specific reasons, not everybody, but for specific reasons where you can actually do some reablement work that then will make a difference. So that is in the thinking around certainly some of the stuff in DG1, DG2. I know their one team approach is looking at what's the role of STARS in there. And from what I've seen so far, it is looking at how you pull that back to be much more core in terms of what the original idea behind STARS was. And that we then try and address the issues about the provision of home care in a different way. STARS is not used that often to do that, but I know there are often requests for that, if people are not able to find it. But we're really looking at how we use CAS to do that much more, and the whole raft of the care providers. Now with the new tender, with the new framework, that should help with that one, and again help people to be really clear about this is the STARS role, and in order to support the whole system, we have to be able to support people to do what it is that we want them to do. And I think that is really key about this. And I think the bit that I think is really encouraging is that the action plan will be coordinated by the Chief Officer. So all of the leads who are picking up each of the pieces will meet with the Chief Officer on a regular basis, so that it is the bit about not just monitoring each of the individual actions, but we're looking at it as the whole and saying, okay, what is the impact of that in this area having on this over here, so that you get that whole system approach to things. And therefore, if stuff does start to sort of impact, say, for example, on a service like STARS, we could maybe then pick it up much earlier and say, no, that's not what we intended to do. We need to look at why that might be, and we need to make adjustments if we can. So I am pretty confident that it's more on the radar, I think, at the minute around what the potential issues have been and how we actually try to address those.
Councillor Driver.
Thanks very much for letting me back in here. I reported yesterday to the Joint Consultative Group that I was up in Cosla on Monday for the Best Value 2 process that's going to happen very shortly through Cosla and the Audit Scotland and Improvement Service. And certainly one of the things they are looking at is the new IGBs. They called them immature. I called them pretty young as opposed to immature, because there are certainly some mature members on the boards of the IGB. And one of the things that they said quite clearly is that you don't have to look for an audit outside of your organisation. Self-assessment is really important, actually doing it. Now, you've mentioned self-assessment, and we were probably more critical than what the report actually came back. And that's a good thing. I see that as a good thing. So talking to, listening to Jane and saying, what is the issue here? Are we just being nice to each other? I think actually we're more critical of ourselves than we are, than we should be at times. We should be sort of saying, well done to ourselves. Not getting away from the fact that certainly with the report here, we can actually improve on it, and there are steps in place to adequately do that. But I think self-assessment is really, really important for the IGB and for social work department itself. As for the sort of step up, step down side of things, I think I'm really looking forward to what's going to happen in the S Valley project, for instance, where potentially we have an opportunity there to bring all of those things together and hopefully move forward in a much better way, a more rounded approach to the individual's needs as opposed to the clinical needs of some of these things. So I'm really looking forward to that. But it's just the Audit Scotland have said that the 6 councils next year won't be Dumfries and Galloway, and it'll probably be the second year. But potentially the IGB could be for one of the first evaluations that Audit Scotland actually do, and I think that would be useful for them to have that. But certainly self-evaluation is one of those tools that they're actually asking us to use to be more self-aware, risk-aware rather than risk-averse.
Thank you for that. Councillor Nicholl.
Thanks, Chair, for letting me in again. In response to Jane, am I right in assuming that you are going to bring back a report giving some indication of how the money is being spent and where we're getting value for money out of that? Is that going to come back to this committee, or did I misinterpret your response?
No, what I said was as part of the action plan and the progress, I would give an update on where we were at. I didn't give a commitment in terms of spend. That's within the remit of the IGB.
Yeah, I appreciate that, but it is our money that we're giving to the IGB. As IGB's money, it comes through us and it's allocated to them. And I think that members might benefit from the knowledge that it is being spent in a proper manner, and it is not trying to be critical. I'm not saying they're going to misspend it, but it would be nice to know how it was spent and where it goes and what proportions.
Certainly, it's reported to the IGB, and I will seek governance advice on whether that can be shared with Service Committee.
Thank you. The review of the Health and Social Care integrated budget for the IGB as part of the annual budget process actually falls within delegations for full council.
Chair, I'm not fussy where it comes, as long as we see it.
No member? Okay, can we move to the recommendation? Jane?
As you were going to the recommendations, Chairman, I wonder, I'm totally in support of what Councillor Dick has suggested, so I'll leave him to say that. The other issue about where these reports go, where does housing go? There's an issue about housing in here, which I don't think is necessarily being picked up, and I just want to know where that goes, where that piece of information goes.
Councillor Maitland, housing is reported via the IGB. Okay,
if there's no other member, can we move to the recommendation? Claire?
Okay, thank you. You've I think you agreed to an additional recommendation to receive a report back at the next meeting, which would detail the action plan timescales and would include an interim progress report.
Members content with that? Thank you. We'll move now to item 7. So these are notes of Dumfries and Galloway Adult Support Protection Committee workshop on the 9th of June. It is for noting. Can we note? Move to item 8, and similarly, it is a report for noting. Can we note? Thank you. So, Councillor Dick?
Sorry, Chair, I was just wanting to ask a couple of apologies from the Council at the last meeting there. Do we have substitutes for this particular committee? And if we don't, is there some mechanism by which we can make sure we do? Because I think it's obviously important to get to make sure at least there is representation from elected members.
I don't believe there are substitutes for either of these committees. Councillor Dempster would normally attend the Child Protection Committee, and normally I would attend the Adult Protection Committee. There is one, I think, next week, which I'll be going to. So we've noted item 8, and I have no further business. Thank you all for your attendance. And just to add for Councillor Davidson, he is very welcome at this committee.